Good afternoon, everyone, and welcome to today's budget lockup. Bon après-midi, tout le monde. Bienvenue à le huis clos pour le budget provincial. Finance and Treasury Board Minister Ernie Steeves will make a short statement, and then we'll take some questions. Le ministre des Finances et du Conseil des Trésors, Ernie Steeves, fera une courte déclaration et répondra aux questions.
All right, hi everybody, bonjour. In approximately about an hour from now, I will be standing in the Legislative Assembly to deliver our government's 24-25 budget. The theme this year, as several of you saw yesterday, is stronger than ever. Let's keep building. This is an exciting time as our province is in the midst of significant transformational movement. And our government is determined to continue to build a stronger province for everyone who calls New Brunswick home. Private sector investment is growing, job opportunities continue to grow, and more people than ever are choosing New Brunswick as a place that they want to put down their roots. Our government is proud of the work that we've done since taking office and all that we have achieved. We have consistently delivered on our promise to be responsible with taxpayers' money, reducing our net debt by approximately $2 billion. At the same time, we have significantly increased spending on important public services, including health, education, and social development. Since tabling our first budget, overall spending has increased by 27%, and we have provided more than $370 million in tax relief to New Brunswickers. We've accomplished this while achieving a surplus every year that we have been in office. During what's been an incredibly challenging time as we navigate a global pandemic, high inflation, and increased demands from a growing population. We've made these important strides forward by staying committed to strong fiscal management and by considering the long-term financial health of the province and the future generations. Budget 24-25 is a continuation of this work. This budget builds on what we've achieved so far and reflects the increased demand for public services that come with growth. We're coming into this budget stronger than ever as a province, and it positions us to continue building while enabling us to deliver services to meet the needs of our growing population in a fiscally responsible manner. Today's budget, which shows a projected surplus of $41 million, reflects significant strategic investments in key priority areas. In health care, we'll be allocating nearly $3.8 billion to our health care system. It's a $1 billion increase over the level of spending seen in Budget 2018-2019, and a 38% increase in just 6 years. And this includes approximately $23 million in technology initiatives for more efficient and better access to health care services, as well as $20 million to expand collaborative practices in primary health care. In education, through the Canada-New Brunswick Canada-wide Child Care Agreement, we will provide $7.4 million, bringing the total investment to $150.7 million to improve access to affordable, quality-designated child care spaces throughout the province. As well, we're investing $18.6 million to address the challenges that come from enrollment growth. The New Brunswick Housing Corporation will see an increase of $68.9 million in this budget. That's a 54.1% increase over 23-24, and that builds on the momentum established since releasing the New Brunswick Housing Strategy, Housing for All document. This budget includes $6.6 million to address the pressure of population growth that leads to increasing demand for driver testing or inspection or enforcement services, court caseloads, increased inmate populations, with a further $5.3 million to help make communities safer. Another $18.7 million will be spent to continue to implement initiatives outlining in our nursing home plan, which will, with an additional $2 million to help seniors remain in their own homes through the Nursing Homes Without Walls program. Through the Canada-New Brunswick Aging with Dignity Funding Agreement, we are investing $7.3 million to support high standards of care in long-term care facilities and to continue to provide and enhance home and community care services. These are examples of the significant investments in Budget 24-25, and what's included in areas that are important to New Brunswickers. It's a budget that will allow us to continue to manage our finances responsibly while addressing the challenges that come with a growing population. It will also enable us to build on the positive momentum we have created since taking office. We know there's more to do, and we look forward to continuing to build a stronger New Brunswick. Merci.
We'll now proceed with questions from members of the media. I will try my very best to allow each reporter one question today. I will be rotating by news organizations. You have the right to pose your question in the official language of your choice. Maintenant, nous allons procéder aux questions des journalistes. Je vais faire mon mieux possible pour mettre à chaque journaliste de poser une question aujourd'hui. Je vais faire rotation des organisations de presse. Vous avez toujours le droit de poser vos questions dans la langue officielle de votre choix. Jacques Poitras, CBC.
Minister, you indicated yesterday that there might have been a change in how you are forecasting federal revenues to avoid these dramatically higher than forecast surpluses. What has changed in how you're forecasting that to avoid being off target again this year?
What we're hoping will change is I've written to the finance minister federally, and we've started talks mostly at the deputy minister's level at this point to try and improve the situation, to try and give us more of an idea into what the revenue is going to be instead of finding out in December that we have a huge amount of revenue coming in.
Alexandre Boudreau, l'Acadie Nouvelle.
There doesn't seem to be a lot of any initiatives for healthcare worker retention in this budget. Why is that? That was one of the big asks of the Medical Society and the NB Nurses Union.
Yeah, thank you very much for the question. Yeah, we certainly do value all of our medical professionals. With the nurses in particular, now we are coming up on contract talks. So I'm sure there will be some talk of that during the contract talks, but that's where the money will be spent at this time, is in the contract talks. It's supposed to start very shortly, I think early April.
Alex Villeneuve, Radio-Canada.
Merci. Il n'y a donc pas de baisse d'impôts dans ce budget-là, de nouvelles. Est-ce qu'il y a une mesure pour aider les personnes de la classe moyenne à vivre avec l'augmentation du coût de la vie?
Yeah, well, one of the things that we've done for middle-class people to help the rise in the cost of living is the workers' benefit. Now, so we have about 35,000 people who've already been cleared for it, and about $7 million has already been sent out, but we want more people. There are more people that are eligible, so apply. It is not a hard process. It takes like 5 minutes, and it's free money, and it's not taxable. It's $300, workers' benefit. So that is one way that we're trying to help the middle class, for sure. I mean, you know what? There are other ways as well with the mini-split program and with any number of different events. And when I talk about $370 million in tax cuts, that's over the last 6 years, obviously. Or the last 5 years, this is our sixth. But there's still talk all the time of more ways that we can make it better for taxpayers here in New Brunswick, and that continues. I mean, we just got this budget finished. We're just presenting it today, but yesterday I was talking to some staff about another tax cut, so, or at least a way to help all classes of New Brunswickers.
Andrew Waugh, Post Media.
Minister, you're talking about this record health spending, but it looks here like a year-over-year projected increase of 0.04 of 1%. How is that going to address the problems that we're being consistently told about the health system, and how much more money is needed to fix those problems?
I think when you're looking at your numbers, Andrew, I think that you're looking at third quarter numbers compared to now. And the third quarter numbers would have had travel nurses in them. Now we are not forecasting for travel nurses because Horizon is going away from travel nurses over the next short while. And we are also working with Vitalite to see if they can move on from travel nurses as well. Because the increase is over 6%. It is the largest health budget we've ever had, and it is a substantial increase.
Laura Brown, CTV.
It's technically $2 million year over year, though. The actual value of the budget last year. You're just kind of taking that into account for this year's budget, if I understand that correctly.
Yes, as I understand it, as I understand you, that's correct, yeah, so.
I wonder, you just mentioned tax cuts, but is this it? Or do you foresee some changes, potential programs coming this year ahead of the election?
Yeah, you know what, we don't do it because of the election, we really don't. I mean, Premier Higgs has stated that all along, and so have I. You know what, we make decisions that are good for New Brunswickers, and you know what, I think it was Minister Fleming who coined the phrase at one point, we don't budget for the next election, we budget for the next generation. And that's absolutely the truth. We do not make decisions based on the next election. We make decisions based on what we financially can do, what's best for New Brunswick, what's best for the economy, most of all, what's best for New Brunswickers.
Silas Brown, Global TV.
Just back to the health spending,
Yep.
even considering the projected numbers from last year, it's still far below the ask of the Medical Society and the New Brunswick Nurses Union, who wanted to see significant investments to catch New Brunswick up to similar health spending to comparable jurisdictions. Last year, for many years, New Brunswick has been the lowest per capita in terms of public health spending in the country. Does this catch us up in your mind?
I think we're headed in the right direction when you talk about the largest healthcare budget ever. And as for the continued spending, I think that you will see there will be considerable spending when the time comes to negotiate with the nurses. I mean, you know what? That's obvious. So.
Thank you much. Hina Lam, Canadian
Hi,
Press.
Minister. I was wondering, how do you call this a healthcare budget when the spending is just about increased $2 million? Won't that represent cuts?
No, I think that I think you'll find it, and you can talk to the technical folks back there. They'll give you the ins and outs of all the dollars and cents. But no, it is more than $2 million. But it's making hard choices and making good choices, and I think that we've made the proper choices for New Brunswickers. And when you're talking about $3.8 billion for our healthcare system, that represents $1 billion more. That's like 38% more than when we started. So it's huge money. Do we regret it? Not at all. I mean, we absolutely need it for our healthcare professionals and for the health of New Brunswickers. And so it's where we're at, and it seems to be a good amount. But keep in mind, we have made changes mid-year before, and if we have to again, then we certainly will.
Cédric, l'Acadie Nouvelle.
Bonjour. Plusieurs groupes de pression ont demandé la suppression de la part provinciale de la TVH sur les nouvelles constructions multirésidentielles et une réforme de l'imposition foncière pour les propriétaires d'appartements. Est-ce que je vois ça nulle part dans le budget ici? Est-ce que vous allez considérer ça à l'avenir?
We've talked about it. We've talked about it, Cedric, but we have decided at this point not to move ahead with that. We have done a lot for the property owners. We've cut a lot of taxes. A big chunk of that $370 million I was talking about was property taxes. So we continue to look at different ways to help all aspects of the economy, and certainly housing is a big part of it. I mean, it's one of the big four is what I would call it, education, social development, health, and housing. And, that's we're working towards it as best we can. But at this point, taking more tax cuts away from property and the like, no, I don't think that's where we're going to go at this moment.
Nicolas Steinbach, Radio-Canada.
Merci. Vous dites que le rythme de croissance des recettes des dernières années devrait ralentir. Pouvez-vous expliquer pourquoi est-ce que les recettes vont ralentir, vont diminuer dans le futur?
Sooner or later, these numbers will level off. That is the way it is. I mean, is the immigration going to stay at the same level? You know what? We're doing our best to predict that as best we can. At this point, we think that, okay, keeping up these expenditures at the same level is going to be hard. So we may have to cut expenditures through the year, but once again, it's like making changes in spending, and you spend more through the year, and sometimes you'll spend yet less through the year. But at this point, we're going ahead with it. I think in future years, and they're talking more long term, that these expenditures are going to be, at this pace, are going to be hard to keep up.
John Chillibeck, Post Media.
There were calls for some quarters that the provincial government relieve the HST on power bills. as of April 1st, most residential customers are going to be facing a 13% increase. Why is there no direct relief for those people?
You know what? I think that for a lot of the people, this workers' benefit could be direct relief, could be certainly a large part of relief. It's $300, and it takes 5 minutes online to get it done. And it's $300, and folks, it is tax-free.
New MC, Radio-Canada.
Oui, alors je vois que dans les montants que vous avez annoncés, notamment en santé, ce que vous montrez le plus, c'est vraiment beaucoup d'investissements dans les modes de santé virtuels et technologiques. Est-ce que ça veut dire que d'une certaine manière, vous avez renoncé à des soins plus physiques, de proximité, et que vous avez décidé, vous pensez que la solution dans l'environnement de la santé, à la crise dans le monde de la santé, c'est surtout du côté virtuel, des soins virtuels?
You know what? That is where we are right now. Absolutely, that's a big part of it, and we're excited about the innovation that can help New Brunswickers. $10 million to begin developing a standardized clinical information solution. Doctors, nurses, health professionals all wanted this for a long time. $6.9 million for the MB HealthLink and eVisit MB. $2.1 million for the electronic patient care records within ANB. Couple million to modernize the electronic medical record used at community health centers. These are all great investments. Are they bricks and mortar? No. Are they people? No. But they are an investment that help us deal with our lack of people right now, and we continue to look to recruit more all the time. I mean, every nurse that enters nursing school now will have a job offer. So.
Okay, we have a few extra minutes, Minister, if you need to take a drink of water. Jacques Poitras, CBC.
Round two. I want to follow up on Laura's question. Are you not ruling out a possible additional tax cut announcement before the election campaign?
If we do an election, or if we do a tax cut announcement, it won't be because of an election. It'll be because it's right for New Brunswick.
But would it be before the election?
I have no idea. I mean, we don't have a time frame for it yet. We were talking about something yesterday, myself and some of the senior staff. But those things don't roll out overnight, for sure. And if you try to do them overnight, then they get a mess in a hurry. So, yeah, so we started talking about it. We think it's a good idea, but we haven't come anywhere close to approaching cabinet with it yet or anything like that. So.
Alex Villeneuve.
Pour l'instant, votre 40 millions de surplus, est-ce que vous envisagez le mettre dans la dette? J'aimerais savoir combien que vous espérez mettre dans la dette essentiellement.
We'll worry about what goes on the debt at the end of the year. I mean, right now we're saving it there, and if it needs to be spent through the year, I mean, that's going to give us a little cushion throughout the year. If something comes up and you need to spend money, then it's good to have that $41 million available to you.
Andrew Waugh.
Why should New Brunswickers have any faith that your projections will be correct this year, given how wrong they've been for multiple years?
I'm sorry, I missed the first few words.
Oh, sorry. Why should New Brunswickers have any faith that your projections are going to turn out to be correct when they've been so wrong for the last few years?
I don't know. You know what? I think that they would look at this government and hopefully see what the government has done for them. When you're talking about $370 million in tax relief, when you're talking about the mini-split program, when you're talking about the raise in social assistance rates, when you're talking about the low-income seniors going up $200 more a month, when you look at all those things, you know what? Yeah, the numbers we got from the feds, and it's a partnership, and you'll see the same problem with other jurisdictions that do that work with the feds. You know, all four of the Atlantic provinces, Ontario is there as well. I mean, you know, but can we blame it all on them? No, that's not what I'm trying to do. But I am trying to explain it. But having said that, I think that they can have faith in us. That they look at our track record for the last 6 years and what we've done to save them money, to make their lives better, and to improve the lot of all New Brunswickers.
Silas Brown.
When asked about affordability measures, he pointed to the $300 benefit a couple of times already. That was previously announced. It's open to a pretty limited sliver of the population. You also mentioned the $200 top up to seniors.
Yeah.
That's previously announced.
Yeah.
you may see where I'm going with this.
Yeah, but
pretty
we're
much
paying
everything
for
that
it.
was in your
Okay.
in your speech and in the budget here previously announced. What do you have to say to New Brunswickers who are looking at that and wondering, okay, well, where's my help?
Where your health is in $3.8 billion in healthcare budget. I mean, you know what? This is a budget. It's where we explain the announcements. It's where we do the math. But you said for health? It's
For help.
Oh, for help.
People who are looking for help.
Okay.
The question was about affordability.
Yeah, no, I think you still come to your government. I think you come to your government if you're looking for health, if you're looking to get the job done, absolutely. I mean, it's what I said. If you're on social assistance, the rates have gone up, and now they're linked in with CPI. If you're on the low-income seniors benefit, that's gone up $200 more a month, and it's linked to CPI. If you're have in need of a mini split, we've got that program on the go. We've got social distance rates on the go. We've got more. You know what? That's where you go for help, to the government when it's tough times, and the government has helped you. This government has in particular.
Dernière question, last question, Hina Lam.
Minister, I was wondering, when you talk about help, there's the $300 that you're giving out, but people have to jump through so many hoops for that. There seems to be no real help for the middle class, such as a rent cap or something, which most people are looking for. Why is there no help in terms of any rent?
I talked to a staff member yesterday, and their university-aged kid did it in 5 minutes. So maybe for you and I and maybe some other people here, it might take 10 minutes. But it's for $300, and it's tax-free, folks. Grab it.
Thank you very much, Minister.